Amid the uptick in COVID-19 cases, the states have ramped up vigil and measures. So now the question arises if there would be stricter norms for the travellers. Well, so far the government has not immediately released any plans to make RT-PCR testings mandatory at the airports, according to the official sources from the Health Ministry. Now, the government has introduced state-wise advisory for the states in the light of the COVID surge. On the other hand, the ex-WHO chief scientist Dr. Swaminathan said that there is no need to panic, just be cautious. Now, in the last 24 hours, the country reported over 500 new cases. Karnataka ramped up the testing, but there is no restrictions for now. Now, days after the first case of JN.1 COVID-19 infection was detected in a 41-year-old man from Maharashtra, the state administration has in fact jumped to the action. Maharashtra Chief Minister also chaired COVID review meeting. Well, if we talk about Uttarakhand, it has in fact ordered genome sequencing of all the COVID positive samples. Now, let's take a look as to what exactly Delhi is doing. Well, new guidelines have been issued. Adequate number of COVID samples are to be sent for RT-PCR testing.
You're talking about the COVID, which is, we're seeing an increase. We need to be cautious, but not panicky. We don't need to worry because we don't have any data to suggest that this variant JN1 is more severe or it's going to cause more pneumonia or more death. ऐसा कोई data नहीं है. So I think what we need to do is try to take the normal preventive measures that we are all now familiar with. Avoid being in a very closed environment with very poor ventilation, with lots of people without a mask. So do wear a mask if you are in that type of very close setting.
My colleague Ishika is joining us on the broadcast from Delhi. Ishika, if we talk about the new guidelines that have been issued in Delhi, help us with all the details that you're gathering. Well, we also are getting to know that adequate number of the COVID samples are to be sent for the RT-PCR testing. So precautions have been taken now.
Well, certainly, Riyanka, after the uptick in the cases, in the number of COVID cases across the country, the national capital is on high alert. In fact, if we talk about yesterday, there were 500 new cases that were reported in India. Now, if we talk about Delhi here, the Health Minister, Saurabh Bhardwaj, is in fact, conducting meetings with the hospital authorities to check as to how much they are prepared for this new variant of COVID. Not just that, he's also said that the adequate number of samples are now being sent for the RT-PCR testing. And the department, in fact, has also ordered for the genome sequencing. Not just that, let me also tell you that previously also the health minister had held a meeting with the experts, in fact, over the respiratory drugs. Not just that, in fact, if we talk about, the department, the health department, they are also, in fact, advising people that right now they can take precautions at their own level. But right now, Riyanka, we are also seeing that in fact in the national capital the cases haven't risen as much as compared to the other states. That is why the people at this point of time are not being asked to wear masks, but certainly the experts say that at our own levels we can be responsible enough to take enough precautions to save ourselves. Over to you.
Okay, Ishika, appreciate you joining us with all the details. Let me go across to my colleague Srushti, who is joining me on the phone line. Srushti, now if we talk about Maharashtra, well, there have been steps that are being taken now and the state administration, in fact, jumping into the action. Give us all the details that you're gathering in terms of the measures that have been taken.
Well, definitely yesterday, Chief Minister of Maharashtra, Eknath Shinde, has chaired a high-level meeting regarding the new JN1 variant of COVID-19. He has mentioned that and also asked the authorities to check the fire audits, to check all the preparedness which was done earlier regarding COVID that should be in place. He has also directed that task force should be appointed to deal with the situation of this new variant of COVID-19 JN1. He has also mentioned that all the departments should take care and in crowded places, even the commoners, if they feel that they are going to the crowded places, then they should try and use mask, is what he has said. But he's also mentioned that it's not a serious situation as of now, so people should not worry and should not panic. But yes, preventive measures should be taken. Today, Tanaji Sawant, who is a health minister of Maharashtra, he will also be chairing a high-level meeting wherein he will be deciding the SOPs regarding the same. But yes, Chief Minister of Maharashtra Eknath Shinde has given out the directions to all the top authorities in the state to take measures and to do the preparedness of the Gen 1 variant. However, the 11 cases of COVID-19 was reported yesterday in the state of Maharashtra. It's not a high number, but yes, checks and measures should be done, is what Chief Minister has mentioned.
Okay. Okay, Srishti, thank you for giving us all the details. Neha is joining me now from Bengaluru. Neha, if we talk about Karnataka, well, it is in fact sharing the border with Kerala, and in fact the restrictions are more strict there given the conditions of the COVID-19 cases rising now. Help us with all the details that you are gathering in terms of the measures that have been taken.
Well, yes, it was only yesterday that we saw the Karnataka Chief Minister, in fact, going on to chair a meeting with the Technical Advisory Committee where, of course, instructions were laid out quite clearly. A cabinet subcommittee has also been formed now, to specifically look into COVID-related matters. Apart from that, of course, we're seeing that the border surveillance between Karnataka and Kerala has been ramped up across the border in districts like Chamarajanagar and, Kodagu as well. More importantly, masks had already been mandated for 60 plus people. And now we're seeing that the government has also recommended that, while in crowded public places, people keep their masks on. So there's no reason for panic at this point in time. But having said that, it is, of course, important to be cautious and vigilant. As far as, of course, the patients at the hospital level is concerned, all hospitals have been directed to, set up separation, isolation wards, acquire the kits as well, the testing kits as well, both RTPCR as well as the rapid kits. And as on tomorrow.
Okay, Neha, I will have to interject you there. I'm running short of time. Thank you for joining us and bringing us all the details. So those were the updates that are coming in that we are tracking on Mirror now in terms of the COVID-19 cases and the measures taken by the states.